This conversation about autopsies is effectively like when a lion is targeting a buffalo and it grabs the neck and it just holds it, knowing that it's a matter of time before that animal is down. This is like what autopsy is. It is the crunch, it's the thing that everybody is afraid of looking at because the implications are so significant. You can't get out of autopsy evidence. And this is why it seems that it's a struggle to find peer reviewed published data. And as a result, sometimes you have to use non peer reviewed data. And I'll be talking about Professor Arnie Burkhardt's documentation again. And it's that kind of picture that we have to therefore concentrate on. So, what I'll start with is one of the questions that I'd had very early on in the pandemic. And it was around the vaccine that was developed against SARS-CoV or not developed against SARS-CoV. And I did this in about October of 2022. At the time there, I had asked the question simply, even though we knew about SARS-CoV in 2003, why was there no vaccine that was developed against it? And it was very simple, is that by the time they had done all the studies, including the challenge studies, they came to this conclusion that even though the SARS-CoV vaccines all induced antibody protection against infection, challenge, that means on re-exposure of the mice at the time and ferrets, of any of the vaccines led to the occurrence of T helper type 2 immune pathology, suggesting a hypersensitivity response. This is pretty serious, and it's therefore something that nobody wants to find now, but it is essential for us to be able to get to the bottom of. Because without that understanding, we are flying blind. This is why I talk about the fact that autopsies are the way that we'll be guided to find answers for people who may be having issues, and we'll learn how to be able to mitigate it. So I know that by hammering home this question about autopsies, there is no easy way to get out because everyone in the medical and the scientific community knows that autopsy is the gold standard. There is no easy way to go. So, one of the things that we have to be able to understand is this thing about vasculitis. That's really what I am looking for here. And I've got this here from my pathology report because I thought this was a pretty good description as to what was going on. You have here a blood vessel, and you have the lining of the blood vessel going around. This is the inside of the blood vessel with the endothelium, and the outside of the blood vessel with the tunica adventitia. And then what happens in vasculitis, that's inflammation of the blood vessels, you have these accumulations of perivascular infiltrates all around the blood vessel. And then it can damage the walls in the context of this inflammation. It is it can occur just commonly from a viral infection, but if it's present, this is always a very, very serious finding and something that we try and look for and try and mitigate. There is no easy way out of a vasculitis if we start to find evidence of it in the context of what is happening. And so when I took this paper that we looked at before with regards to the immune pathology, immunization, as we said, with the vaccines for SARS-CoV in 2012. So this paper here was published in 2012. So they were looking at trying to find solutions for the SARS-CoV in case there was a SARS-CoV-2. But they realized that it led to pulmonary immunopathology unchallenged with the virus. And so what I then did is that I did a search of this here, and you can find it here, is that I then looked through, doing the search, for perivascular infiltration. Everywhere there was perivascular in this paper. And you can see here that they were looking for perivascular cellular infiltration. As I said, that's indicative of vasculitis. There were 9 places in this paper that they were talking about perivascular infiltrates. Okay. So this is how I know what we saw then and what we should be looking for now. And that's what nobody wants to do in terms of seeing this, because as I said, there is no easy way to explain it away. It has to be investigated. It needs to be clarified. And so there we come to the question about what did Professor Burkhardt find? So in case you didn't know, he's a German pathologist. He had looked at COVID early in the pandemic, trying to understand it. He was one of the early people who published papers on it, trying to understand the disease. And at the same time, he also looked at what happened in people who had been vaccinated who had died. Sadly, he died sometime after he'd made this publication, which was not appreciated. And so, in a sense, we lost this valuable work that he was doing. So, here is the work that he did. And he was talking about at the time that their causative role in terms of the things that were going on with regards to after all of the investigations, the autopsy investigations. And so in this, he again highlighted, and he was looking here at 15 cases of people who died, and they recorded their age, the time of death. So this one here is a female, 82 years old. She had 2 doses, and 37 days after she had died, they did an autopsy. So they didn't die of COVID. They died of other causes. And you can see all the different time frames: 31 days, 68 days, 65 days, 11 days, 8 days, 37 days, different vaccine candidates. This one was unknown: AstraZeneca, Pfizer, Johnson & Johnson, Moderna. So this is across the board. This is the kind of research that should have been done, that really wasn't done. But as I explained to you, is that when they looked at all of these cases, this is the thing that stands out. There was extensive perivascular accumulation of T lymphocytes. This is the same thing that I said to you is indicative of a vasculitis, very similar to what we had seen previously in terms of the other animal studies that were done in 2012. And so this is why I'm saying that almost certainly that's why I am calling for autopsy studies, because that's what I am expecting to find as well. But without the autopsies, everything is conjecture. We keep on saying, well, we're concerned, people are dying. We don't fully understand what's going on. It must be COVID. But how is it COVID? And this is where the COVID storm comes in, because the reality is that you may find that somebody had an infection 6 months ago, then they have passed away. You do the autopsy, you find perivascular infiltration. What would then happen is they would try to label that as a COVID death. But we understand from the prior studies that technically this is a challenge situation. That means that there was immune priming and then re-exposure. In that circumstance, you would therefore have to conclude that the immune priming is likely to be a significant contributor to the perivascular infiltration. That's the vasculitis. So this is really what it is that I have been concerned about. And in terms of what kinds of diseases that it tends to cause, I'll show you here that vasculitis, as I said, is very serious. It's not something to be underestimated. And when we look at the types of diseases that are associated with vasculitis, you have large vessel vasculitis like giant cell arteriitis. have medium vessel vasculitis, smaller. As you can see here, this is the aorta, which would be a large vessel. So that tends to be the glandular arteritis. The Kawasaki's disease, medium to small sized arteries. The arterioles will be more the anchor-associated vasculitis. Capillaries is a glomerular basement membrane disease. And you can see the whole range of different vascular diseases that can occur. This is pretty serious stuff. And as I said, it's the one thing that is not easily evaded in terms of the community that wants to put this aside. If you start getting autopsy evidence, no argument that this has to be investigated. Here is some more evidence as to what it would look like in terms of perivascular infiltrates. This here is the blood vessel. And usually this is part of an inflammatory process. And then you have these dots, which would represent the lymphocytes and macrophages that would be accumulating around the blood vessel. And you have to remember, this is oftentimes silent. And it can take sometimes months or years before disease can present. And this is the point about trying to find ways to mitigate this if it's occurring. The first step is the autopsies. Without the autopsies, everything is conjecture. But once you have autopsies and you start to see this on a regular basis, the next question is, well, who is affected? How can we mitigate it? Without the autopsies, we can't get to the second part of the question. And this is why I'm hammering it home. You'll find that this was the point that got me censored once I started talking about this, because as I said, it is so important. It is effectively taking a big company that's making a lot of money and they say, we're doing very well. And you say, have you had an independent audit? And they go, no. And you say, well, we don't know if those numbers that you're giving to us are actually accurate. We want an independent auditor to look at your numbers, look at your products, look at what's happening in the background. After they have done that, if there are no issues, that's when you say that you're okay. So not having autopsies is effectively the same as a company not being audited. And I can guarantee you investors wouldn't do that, wouldn't put their money in a company that wasn't audited, because you can't know exactly what's happening behind the scenes. Just remember, autopsy is the hole that the lion has on the neck of the buffalo. Once you keep asking for it, there is no getting out. It has to be done. Once it's done, you then have to make sure that the findings are independently analyzed and clinically made in context. And then we can start making progress in terms of finding solutions. There is no doubt that something is wrong. Even the life insurers are talking about the excess deaths now. So something is happening, and we can't know for certain what it is without autopsy. Let me just repeat this to the censors. I am not saying that the elephant in the room is the cause. I am just saying you can't exclude the elephant in the room without autopsy and without research. This is getting harder and harder to talk about because, as I said, the implications are so serious. But I don't think we have any option but to keep on pressing this point home, because at the end of the day, this can affect everyone, families, loved ones, especially older people who may have other comorbidities. We have a responsibility to keep on investigating, even if it's inconvenient, and even if those in power don't want you to ask questions. Have a great evening.